Welcome to the Healthy Brain Podcast. I am your host, Heather, and I'm thrilled to be back with you today. Today's topic is all about the polyvagal theory. So, if you can see right here, polyvagal theory. Many of you have heard about the vagus nerve, especially when it comes to breath work. And my last episode, I did talk quite a bit about breath work and how breathing is so important for regulating our nervous system. The polyvagal theory, you may not have heard of this actual theory, and I'll explain what it is. But the premise is it involves the vagus nerve, that's why vagal vagus nerve. And the vagus nerve is a cranial nerve. Our body has, our brain and body have 12 cranial nerves, and this is cranial nerve number 10. And the vagus nerve innervates the heart, lungs, and digestive system, and specifically through the diaphragm, which is really between the lungs and the digestive system. And that is important for a variety of reasons, but you think of breath work, lungs, diaphragm, really important. Also the heart. So the vagus nerve has a crucial role to play in our biofeedback. And that's why there's a lot of talk about the vagus nerve. But why I want to talk about the polyvagal theory is that once you understand how our autonomic nervous system flows and how it reacts and how it works. And I'm not going to get too sciencey here. I really want to make it digestible. But when you understand this polyvagal theory, then you can understand why certain things in your life can be triggers for the nervous system dysregulation, why stress, certain things can catapult you into stress, or why you feel stuck and frozen and that you feel like you can't do anything. The more we understand how our body works, the more that we can work with our body and apply the holistic health therapies that many of my listeners know about, which is the breath work and the meditation. But when is it best to use these holistic health therapies? Because sometimes when you are so frozen in place that you can't do anything, the last thing you can do is an intensive meditation and a self-guided meditation. So I'm going to guide you through this, understanding what this polyvagal theory is, and you definitely look it up, start researching yourself, get some education on the theory and the vagus nerve. So the polyvagal theory, it's when the autonomic nervous system provides the neurophysiological substrates for adaptive behavioral strategies. That's the sciencey term. What it means is our autonomic nervous system is always adapting. It has a feedback system where it's always adapting to what stimuli is coming in, either visual stimuli, auditory, what you're hearing, or tactile, what you're feeling, actual sensing with the touch, that's tactile, and behavioral, meaning actions. So what does our body take? What actions do we take? The polyvagal ladder is also a principle of this polyvagal theory. And what it means, it's basically like a ladder. There's rungs, so steps to a ladder. And our nervous system moves through different rungs of the ladder or steps, different states in a specific order. So that's really important to know the order of how our nervous system is reacting to what is coming at you and how you react yourself. Our body's response to stress can be so subtle that when we learn to pay attention to what are the cues or the triggers, we can recognize what our response is to different stress stimuli. And then you can best address, and you can work through how you can get out of this dysregulation when you're frozen, like you just don't know what to do because there's an obstacle. Let's say I work with many of my clients are building a holistic health coaching practice, and they encounter obstacles and their nervous system goes into like a freeze or flight. They want to run away or they want to fight, they want to argue, maybe with themselves or with other people, but their nervous system, it almost hijacks them and they don't know how to get out of this dysregulation. So understanding the vagus nerve and the polyvagal theory, you can gain better control and adapt with your own nervous system. All right, so where should we start? Well, we'll start with, there's three main, and you might have heard of just the sympathetic and parasympathetic response, but we're going to go even a little deeper into, there's a ventral vagal nerve activation, there's dorsal vagal nerve activation, and there's a sympathetic response, and there's also a combination of the dorsal vagal and the sympathetic. So the ventral vagal nerve activation, when you're in that state, you're in a relaxed state. This activation triggers a release of neurotransmitters that help to reduce the heart rate, lower blood pressure, reduce stress and anxiety. This is really that parasympathetic state that you're in, meaning you're the relaxed rest and digest. And many of us know the vagus nerve as, okay, does it activate the parasympathetic nervous system, which is that relaxation, or is it sympathetic? The sympathetic nervous system is the fight and the flight response. So you have already two nerve activations. It depends on your nervous system. Are you going to be in more of that relaxed state, that ventral vagal, or are you in a fight flight state? So you want to fight or you want to flight, you want to run away. And many of us, and this was me for many years, that's what got me into this coaching platform and working with coaching clients, where I merged brain science after working for over 20 years in brain rehabilitation and working with the neuroscience and seeing the benefits of certain holistic health therapies and merging it with the neuroscience. That's why I really am passionate in sharing the reasons and the science behind why our body works a certain way, why our brain works a certain way. So noticing, are you in a ventral vagal nerve activation, or are you in a sympathetic response, the fight and flight? And that is when we're in chronic stress, we're just always like, we're either like really anxious or we're just hiding away. We're running away from our problems because we don't have the nervous regulation in order to go through the obstacles that we may encounter. So those are two states there, the ventral vagal and the sympathetic. And I'm going to throw another one in there. The dorsal vagal nerve activation is where we're in shutdown. That can be seen in people who have had significant trauma in their life, where they are shut down. They just cannot make any kind of behavioral change. They're shut down, locked. I don't want to say locked away, but they're just, their nervous system is shut down and not allowing them to do any action. So if someone is in the shutdown, the dorsal vagal state, to ask them to, okay, I want you to do this self-guided meditation and sit and meditate, and I want you to do all these higher level thinking things, they're not able to do it. So we need to adjust our approach for these clients or anyone who's really experiencing shutdown where they just are like, nope, can't do it. It's just not going to work for me. So that's the dorsal vagal. That is really where that's a really primitive state that people can be in at times. And then there's a fourth state, which is a combination of the dorsal vagal and the sympathetic, and that's called the freeze. So the fight, flight, freeze, that freeze is really a combination of a shutdown, which is the dorsal vagal, and the sympathetic, which is the fight and flight. So it's sort of in between those two stages. You have this freeze state where it's not quite shutting down, but people are literally like frozen. Like they may even think, I know what I should do, but I just can't do it. Whereas shut down, it's like a lot, it's too much. It's an overload and a complete dysregulation of the nervous system. Now, thankfully, most of us, like if you have a fairly dynamic nervous system state, you're going in and out of that ventral vagal to the sympathetic, maybe sometimes into the dorsal vagal and sympathetic freeze state, but it's a significant step when somebody is in the dorsal vagal, the shutdown. And that's where they may need to work with a clinician to help work through the this shutdown that they're experiencing. And that's why therapy can be very helpful for in this particular case. So when I talk to someone in a possible coaching scenario where they're looking at working with me as a client, as a coach, I look to make sure that people are more in that sympathetic, ventral vagal nerve activation, maybe a little bit of the freeze, but they're not in the shutdown. They're able to get themselves out of the freeze mode at times. And that's really when coaching is most effective, is when people are in those upper three stages of the polyvagal theory of you're able to make change, but I'm able to help someone when they're sort of frozen, they're not shut down. That's more for therapy. But when somebody feels like they're always sort of running away from difficulties, but they know they want to make some change, or they feel like they're frozen in place, they just don't know the first step, their brain takes over as far as the response of like, I just don't know where to start. I'm frozen. I can't quite make that first step. Then that is where the coaching can really be helpful, because we start talking through, okay, what are the scenarios? This is normal to feel this way, just reminding the brain that, hey, we can make this step through and go from a freeze to the ventral vagal nerve activation. That's what we really want to get to. We want to get to that, more of that ventral vagal nerve activation. Before I get into how to apply the polyvagal theory to your stress management and your self-care management, I do want to say that going through all the states, it's important that your body is able to go through the different states. If it's ventral vagal, if it's sympathetic, when you have something coming at you, which is possible danger, or the brain is worried for your safety, your nervous system has to react appropriately. So all of these states are normal. They're normal. It's just how long are we staying in the particular state? We don't want to stay in the sympathetic nerve activation. We don't want to stay in the sympathetic response, the fight, the flight, the freeze, and the shutdown, of course. But we don't want to stay in those. We want to be able to go in when we need to make sure our body, our brain is protected, but we want to shift out to a more relaxed, reduced stress, reduced anxiety in order to go forward with our behaviors, our actions that we want to take in order to reach our goals. So I just wanted to make sure and reiterate that it's really important that we have these different states. That's not at all what I'm saying is like you want to prevent yourself from going into it. What I'd like to see is like, how can you change that state if you notice you're in a particular fight, flight, freeze? What can you do in order to get back into a ventral vagal state? So first off, you identify your triggers. So notice what is a trigger for you, a cue for you to, what makes you stressed out and what gets you into a high stress and anxious state. Sometimes people will say they start feeling it in their tummy or their throat or their chest area. Just they feel like, oh, like they're feeling this stress and anxiety as a precursor. So first identify the trigger of what is really stressing you out, causing a lot of dysregulation. And one thing that I really like to teach is a green, orange, and red, almost like a stoplight. So a stoplight kind of technique. So if you're in the green, that's the ventral vagal state. You're feeling present, you're grounded, you're balanced. If you're in the orange state, stoplight state, you feel a little bit stressed and you're getting into this fight and flight stage. You could also be, I don't have a color necessarily for the freeze state, but we'll have to come up with that. Maybe it could be a really light, let's say a light red, okay? It's between orange and red. That's when you're in the freeze state. And red is the stoplight red when you're in the dorsal vagal state. You're depleted, you're shut down, like you are just, oh, you can't do much. So noticing what, and I actually ask my clients to do this every so often throughout the day, like check in, are you green, orange, light red, or bright red? And the more you are aware of what state you're in, then the more you can pick the correct technique. So let's go through this. So let's say you're in the orange or sympathetic state, you're feeling in the fight and flight stage, you're feeling stressed. You can ask yourself to rank, how is your body feeling? Am I feeling 1, which is calm, 3, somewhat activated, or 5, I'm feeling really stressed and intense. So if you're feeling 1 to 3, so you're between calm and somewhat activated, you're feeling like this fight flight kind of orange stage, try a couple of things. These are some of them. You can do a guided meditation, calming breath work. You can do a 5, 4, 3, 2, 1 senses scan. And off the top of my head, I have to remember like 5 things that you see, 4 things that you hear, 3 things that you can touch, 2 things that you smell or taste, and then 1 that you taste or smell. It's one of those. I'm sorry, I always mix up the last couple of ones, but it's basically being aware. It brings you to the present moment. So doing that 5 senses observation technique can be really helpful. Also, if you're in the 1 to 3 stage, like you've ranked your body in that 1 to 3, maybe you're feeling a little bit activated. You can rub up and down your forearms, opposite hands to forearms, rubbing up and down or squeezing your forearms. That helps. That's that tactile feedback. If you're in more of a 3 to 5, so you're activated or you're feeling very stressed to intensely stressed out, you may be too dysregulated to sit down and meditate. So you may need to do something active, like walk, work out, shake it out, dance, move your body physically. That is very helpful when you're feeling very activated and stressed. Now you're still, again, you're in that orange stoplight, but within that orange stoplight, you've ranked yourself 1 to 5. Am I a little 1 to 3, somewhat activated? That's when you can do those calming breath work, the guided meditation. If you're 3 to 5 and you're feeling more intensely stressed, you are too dysregulated, get up and move. And then when you get down, you can do another check-in when you're below the 3 or 3 and below, then you can sit down and meditate, do some breath work. If you're in the freeze state, which is the freeze and the shutdown, which is the light red and the bright red, you can try a small amount of activation, which could be some more dynamic breathing, such as an intentional sigh. So taking an inhale through the nose, and then another sip of an inhale, and then a long exhale. You could also do a very short guided meditation. Another thing with breath work is counting with the fingers and thumb, so the pointer finger to thumb. So your inhale and exhale is a tap of the pointer finger and thumb. The next inhale, exhale is the middle finger and thumb. The next inhale and exhale is the ring finger. And the next inhale, exhale is the pinky finger and thumb. I've had clients do that when they're really sort of in a freeze state. They do a little activation, like a little motor movement with the fingers. That seems to really help in getting them a little bit of an activation. And then they can start with moving their body, just gently moving their body. And again, this shutdown and freeze stage, especially the shutdown, for some people, they need to have more of a clinician one-on-one work with them. So just be aware that any of these techniques are just suggestions to be curious. How does your body respond to this specific breath work and meditation and movement? And see if your body responds. It's amazing to me when people do feel like they're in the fight flight stage and I put a guided meditation on for them, or I guide them through a meditation. Within 5 minutes, they are feeling so much more calmer. But it's really important to be aware of what stage you're in. And if you frequently go into a shutdown or freeze state, knowing that maybe additional assistance with a therapist is needed, or a clinician that specifically works with, depending on what you're going through. So the body keeps score is a great book that is quite in depth in how our body stores trauma and just a lot of dysregulation that happens in our body. And some people need some additional assistance to help them through. So my goal here for you is presenting this polyvagal theory, knowing that our nervous system goes in different states and stages. And when we know the different stages, you can work on with your own body to know, okay, what helps me to relax a little more? What helps me to activate that ventral vagal nerve activation? But it's first important to identify what are your cues. Second, or cues or triggers that cause you to go into a stress response. The second is once you just identify with the stoplight technique. Are you green, orange, light red, or bright red? And from there, work on just like what is going to be a little bit of an activation that will help you depending on whatever state you're in. And that's a brief overview of how you can really tap into the vagus nerve activation, the polyvagal theory. I of course, have a lot more teachings that I do with my clients when I work with them one-on-one. I help them specifically to overcome obstacles and reach towards their goals, especially if you're working towards a building a holistic health if you're a holistic health practitioner, a coach as well, where you're just having difficulty overcoming obstacles and you can't seem to get traction or any results. So take this information. Hopefully, I'm sure you'll find it helpful. I'd love to know some feedback. Also, if you're interested, you can book a discovery call with me. We can talk about what it looks like to coach with me. And as I guide you towards creating a successful business with a lot of balance in your life and in your work life by managing your time, your productivity, stress management, and really fulfilling your dreams. So you'll find the link for that discovery call in the show notes. Thanks again for joining me. Take care.